Hello, everyone. I'm picking up where I left off. I put the two discussion out for you guys that cover some important things that need to be covered in our lab class. It's not the same as hands-on, and hopefully we'll be able to figure something out about that. Maybe this will suffice guidelines. If not, hopefully we'll be able to work something out when we can get back on campus. But we need to move along and cover as much in lab as we can so that we'll keep things going in the right direction until we know exactly what we're going to be able to do. So I'm just going to briefly go through these slides. They're just here to help you. As I put on the discussion, I put on the two discussions what I need you to read in your lab manual, as well as the videos you need to watch and what you need to do to turn in, because this will help cover some of the things that we would have done hands-on in the lab. As everybody knows, before the whole COVID-19 incident, we were coming into class every day and we were filling out our monthly laboratory maintenance log. We were checking our refrigerator, freezer temperature, incubator temperature, checking our eye wash station to make sure it's working properly. We would bleach down our counters with our 10% bleach, check our trays, make sure everything was stocked properly, wash our hands, and don our PPE. And I'm sure you guys now are seeing how vitally important it is. You never know when there's a virus out there lurking. That's why it's so important to keep your station, your area, your lab, your offices clean. That's why it's so important to wash your hands. Why it's so important to make sure you're always wearing the appropriate PPE. We can sometimes get lax out there in the field and don't pay strict attention to this, and this incident with COVID-19 shines a glaring light on why we always have to be very vigilant in doing the things that we need to do to protect ourselves and our patients' families. So we know we were filling these logs out because we want to make sure that our refrigerator's at the proper temperature, because that's where we store our reagent. And if our reagents are not stored at the proper temperature, then they may not work. And then we're getting erroneous results. Our freezer, same situation. We want to make sure whatever we're storing in our freezer is kept at the appropriate temperature. We want to make sure if we're running tests and we need our room temperature to be at a certain temperature, we want to make sure that's true. We want to make sure our incubator is working properly, because if we're trying to grow stuff in our incubator, we want to make sure that we're having that at body temperature. We want to make sure our bleach, if it's something that we have to make up every day, depending on what product you guys are using, that we're making up that fresh solution daily, and that we are vigilant in keeping our supplies, our area, our countertops clean. If we have things like showers or eye wash stations, we want to monthly check those things to make sure they're in proper working order. You do not want to wait to the time when you actually need the shower or the eye wash to find out that it's not working. So we always want to do this. And we always want to put down our initials so we will know that we're doing it. And you guys were doing this before we left. I just wanted to touch on it so everybody understands. It's easy to know to come in and take this log and do it. But sometimes we're more apt to do these things if we understand why it's important to do it. So make sure that you understand our instruments. These are instruments that we went over, and you want to be able to name the instruments that's in the picture. And the number one instrument we did in our lab, and that's our Clinitech. Okay, and we all found out how difficult it was to dipstick a urine and read it manually. A lot of moving parts. It leaves a lot of room for error. So the Clinitech has really taken a lot of those errors out of the game. So it's a really good instrument. And so what test is run on that? Your UA, right? Your dipstick UA. Okay, picture number 2. We went over this in our last set of slides for our review on our labs. And the third one is included in your discussion, but our second instrument is one we've seen in the lab. We collect this. Now, what's the name of this instrument? The hemostat, right? And what test is run on it? The hematocrit, right? Packs red cell volume compared to the whole blood, right? So make sure that you are studying, you know. Sorry for the coworkers, guys. I know they're loud in the background. What are the normals for men and women for hematocrit? And they do different, and we've talked about why women's hematocrits can sometimes run lower than men's. So make sure you're memorizing and learning these normal values. Okay, instrument in picture number 3. It's the stat site M. And remember, we have a discussion that's posted that you're going to watch a video about the use of the stat site M. You're going to go over these PowerPoints that I'm putting up. You're going to read your lab manual, and then you're going to write up the discussion as per the directions. Okay, and what test is run on the stat site M? Your hemoglobin, right? And what are the normal values for men and women? And remember, with the hematocrit and hemoglobin, it can vary between men and women due to women's menstrual cycle. Okay, now just remember, guys, these, if you go over and over and over and over stuff, that's when you start really putting it to your memory and you can pull it up. And when you're out there working, these are tests you're going to do a lot, and you'll see that you will easily memorize the normal ranges for tests like hemoglobins and hematocrits. But you're going to need to know that for a test. It may be on some registry exam that you take. So make sure you start really taking the effort to learn these normal values. Okay, here's some equipment that we'll go over at a later date. And as a matter of fact, one of them we're going to go over today, and all new stuff. So in picture number 4, you'll see that is the Estrogen Cetiplast system, okay? And it comes, you have a rack. If you'll notice down here at the bottom, that's the little rack right down here that they sit in. Then you have the little piece right here that you put your blood in. Then you take the tube and you push it down into it, and then the blood goes up and stops. It stops at a certain point if you fill it properly, and then you let it sit for exactly an hour, and then you can read and record your results. The test that is run on it is the sed rate test, or ESR, okay? And so what are the normal values for men and women? All right, the next one in picture 5 is the QBC. The test that's run on it is a CBC. And so you want to know what the normal values are for the RBC, WBC, and a platelet count. Number 6 is our coaga check. Now that is the second discussion question that's up. You're going to have 2 discussion questions. So there'll be videos along with these slides, along with the lab that you'll read at home in your lab manual, in your white lab binder. If you read all that together, that's going to help you be able to put this together on how these tests are run. Now, the good thing we have going for us is lab should be hands-on. But honestly, as y'all have seen from using the Clinitech machine, looking at the hematocrit machine, these are CLIA-waived tests. They're very easy to run. If you will make sure that you read on any new test you have, read the package insert, read any information that comes with the instrument, make sure you go through some minor training, and if you will take your time, pay attention, and follow the directions and read the directions and do what they say step by step, these are very easy machines to use. And you always want to make sure, of course, that QC has been ran and you follow the directions to a T and do exactly what the manufacturer says. So make sure you're watching those videos and doing your discussions. So the test that's ran on the coaga check is the PT. And we also want to know what the reference ranges are for the PT test. Okay, so this is, of course, what we would have done in class for our sed rate, right? We would have done this. And even though there's not a discussion question up for this, because I'd really like y'all to go out there, get on Google, get on YouTube, find a erythrocyte sedimentation rate, the Westrogen SETI test. Find you a video that shows you somebody performing that test so you can get a look at it. It's a very simple test to do, and if you follow the directions to a T, it is very easy to do, okay? So remember that when you're doing this test, this is your requisition form, which of course is going to come already filled out, right? Our specimen source for this would be venous. We cannot get enough blood from a capillary skin puncture to do the SED rate test, because that area I showed you has to be filled up to a certain line so that there's enough blood in there that when you push the tube down in there, it goes up to the top line. So you wouldn't be able to get enough blood from a capillary stick. So our specimen source would be venous. If we perform this test, then we must always fill out the test performed by section. And once we get our SED rate result, and remember our reference range is 0 to 20, then we will record it there. We would also record it here on our requisition in our patient's chart. We would record our QC. We would make sure QC had been done. If not, we would do it ourselves, and then we would put it on our patient log. And make sure you're going through that, guys, okay? And then make sure you are reading all this and you understand we always have to check our QC log to make sure QC is run. How many levels? Remember, CLIA says 2 levels of control must be ran every 8-hour shift or each time a patient is being done that day. And in other words, if you know that your particular physician's office lab, and after you've worked there for a while, you'll start to get the hang of this kind of thing, that they almost never do ESRs, occasionally, rarely. Then when you come in that morning, you might not want to go ahead and run controls on that. That's not very cost effective. But let's just say you know that your physician's office lab runs 20 to 30 glucoses a day. Then of course you would go ahead, to be effective and efficient at your job, go ahead and run QC on the glucose machine that you're using in there. If you know you do a ton of CBCs, you might want to go ahead and run QC on the CBC, but not on the SED rate, okay? I hope that makes sense to everyone. So make sure you're reading through that and make sure you understand what's acceptable and that these ranges must be acceptable. So if you have a normal control, that means when you run it, your ESR should come in within what is normal range, 0 to 20. So here we'll see this one was 10 millimeters, so we can accept that, right? Because it worked, it was normal. And normal high means it would be above 20, right? And so 37 is above 20, so we could accept both of these and say our QC's been done for this 8 hours, and you could move on and perform your test on your patient. Okay, so again, here is that SED rate. It has to sit exactly for 60 minutes, not a minute before, not a minute less, right? The SED rate is a non-specific test to detect inflammation in the body, to monitor changes in your autoimmune diseases like cancer, leukemia, arthritis. This is not a test you diagnose somebody with. And in other words, a doctor may do this test and it's high, and he says, this patient has a lot of inflammation. We've got to figure out what's causing this inflammation, this degree of inflammation. So let's just say he runs other tests and he finds out they have an autoimmune disease, and that's what's causing this high degree of inflammation in their body. So then they put them on some type of treatment for this autoimmune disease. And 3 months later, they want them to come back in to see if they now have decreased inflammation in their body, which would tell them if the treatment they were giving the patient was working or not. So they would run another SED rate 6 months later, and what they expect to see is the SED rate should be lower. And that would show that the treatment the doctor was giving the patient was working because they had less inflammation in their body, and this is how they would monitor them, okay? So after those RBCs settle down to the bottom, the SED rate is determined by measuring the plasma at the top of the tube, which reflects how fast the RBCs settled. And they're graduated on here, and you read It's not surprising if someone is normal, you're going to get a 0. And I don't know if you guys can see this because I know it's kind of smaller, but if you'll look right here like this one, if you read it in an hour, that's probably going to be 0. But as you can see this one, you can see some plasma there. And so it has settled out. And so you would read where that line of that serum starts and you record those results, okay? Remember, if you have any questions, comments, concerns about any of this, make sure you email me and we can talk this through, okay? So again, here's a great picture right here that shows us what we were talking about, right? And you read at that line, right? You set your timer so that you can make sure that you check it right in an hour. And here's the tube I was telling you about, and there's a line on that neck where you feel your blood to. Then you take this tube and you stick it down in there, okay? Right down in there, and then the blood goes up into the top, and then you start your timer, okay? So go through these, make sure you read them all, and so that you will understand how it works. And like I said, there's not a discussion on this, so you don't have work that you're going to have to do for it. But guys, these are tests that you may actually do as a lab assistant or a medical assistant when you go out there and go to work and you want to know how this is done. So go out there on the World Wide Web and see if you can find a video that will show you these things step by step so that you can see how this is done. So here's our coaga check, okay? And of course, this is the requisition from lab 15-2. This is your other discussion, okay? Again, you only have 2 discussions, one from labs that were in 14 for your hemoglobin, and then one for your PT here in labs 15, in the labs that are covered in 15. The rest of the labs in 14 and 15, I would like you guys to do what you can to get out there on the web, get an idea of how these are done, see if you can find a small video. You shouldn't take a lot of time. I know you guys got a lot going on, but it's a good idea just to use as many sources as humanly possible so you can truly see how these tests are done. And again, as we know, this is our requisition, right? It would come with all our patient information that we would use to properly ID our patient and make sure that we have the right patient that we're doing our lab test on. This requisition would tell us what lab test the doctor had ordered, which we see here is a PT, right? We would know that our physician's office lab, if that's where we're working, had a coaga check system there, and that's what we use to do these PTs with, right? If you are the tech, the medical assistant or the lab assistant that's performing this test, then you would have to fill out test performed by section. Again, this is something that can do by skin puncture. So if we perform this by skin puncture, our specimen source would be capillary, right? And the laboratory section, if you were doing this in a bigger hospital or lab, this would go to the hematology section, because inside hematology typically is the coag department and the urinalysis department, okay? So this is our rec. We also would want to make sure that we fill out our rec properly, that we check our QC log to make sure QC has been ran. If not, we need to run it. Then we would fill out our patient log and we would chart this on our patient. And we must make sure we always fill out all the documentation. This is what our QC would look like. As we know, CLIA says we run 2 levels of control every 8-hour shift or whenever we've done a patient. Okay, so we see here, you would put the date and your initials that these controls would run. You would write down what control level it was. This is normal. The test you're doing, which would be a PT, then you would run that normal control on your coaga check machine, just like you would do a patient. It read 12 seconds. We know that 12 seconds is within our normal reference ranges. So this one worked. We would check accepted and move on. If it didn't work, we would check rejected. We would figure out if it was the machine, if it was human error, if the controls were bad, what was going on. We would fix that. Once we fixed it, we would run controls again. If they came within range, then we would know that we could move on and start using that instrument on patients. But we would want to document what corrective action we had taken to in turn get our control in range. okay? And then our abnormal high, same procedure, and obviously it's an abnormal high, so we would expect these results to be on the outside the high range of normal, right? So both of these are correct, so we can go ahead and accept these results and move on to testing our patient. Again, there's a video on Canvas for how to use the CoaguCheck machine, but these are some slides that will add to that to enhance your knowledge to make sure that you know how to use this machine. It's very easy to use. The main things are to ID your patient properly, do your capillary blood collection properly, that you use your machine exactly the way the manufacturer has told you to use it, and that you report out your results properly, and that QC has been ran and was accepted. Okay, again, please guys, make sure you read through this along with your video so that you will know, okay, and then complete your discussion for this particular item. Okay, and to cover these, again, these are some other things that are in Labs 15 that you don't have a discussion on, but I would really, really encourage you guys to go out there quickly. You can see from the videos I posted for you to watch, you don't have to find a lengthy video. You can find a video because these tests are not very, very complex. You can find videos that are short and to the point, but visually show you exactly how to do these tests. If you pair that with reading your lab manual step by step on what is done and watching these videos, it will really help you in truly understanding how to run these tests, okay? Now, the thing with the QB Star machine for CBCs, it is not a easy test. It's more of a moderately complex test. That means it takes just a little more studying, a little more training on this particular machine, okay? But it is still, if done right, it is not a hard machine to learn. Same thing, I'm not going to go over this because we've done this on every one, but you guys, when you're reading this, make sure you're putting this together, okay? And then again, we would always do our quality control, 2 levels. Here we have a normal and an abnormal. The way we know this is accepted is we compare our normal to our normal range, and if it falls within normal range, we know it worked and we can accept it. And for abnormal high, it needs to be outside. If the white count says, you know, the high limit is 10, then that white count needs to be above 10 for it to count and be accepted. So you always run your controls or make sure controls have been run each 8-hour shift before you do your patient. So a CBC is one of the most commonly ordered tests, right? And we're looking for, you have an infection, right? You're running a fever, you feel like garbage, you're sick. Do you have a bacterial infection? Do you have a viral infection, or could it be a parasitic infection? Running a CBC helps doctors be able to diagnose patients so they treat them properly. The same treatment that you would use for a bacterial infection is nothing like the treatment that you would use for a viral infection. You're looking for things like inflammation, cancers, leukemia, bone marrow failure, and anemias. And if you see this picture right up here, okay, guys, this is the device. And like I talked about, a lot of these point of care testing or CLIA wave test or moderately complex tests that are done in physician's office labs, a lot of them come with their own device that we collect the blood into. So instead of just using a micro container or a microhematocrit tube, this particular tube comes with the QBC Star machine, and you must collect your blood in this, for lack of a word right now, this cuvette that goes with that particular machine, okay? As you can see from the picture, and like I said, I encourage you guys to go out there on YouTube or somewhere and find a video that shows someone online actually doing this. But these are detailed pictures that show you, okay, how to do it. Make sure you read over this. Make sure you read these exact same things in your white lab binder. You can pause this, you can read it and go over it and make sure you understand, okay? Once we've collected properly, then we can run the test, right? We insert the tube into the instrument, pushing the cap all the way back of that slot. And there's a slot. When the door is open, you will see it, okay? And then you close the lid, press the button to start the centrifuge, and the centrifuge is going to spin that tube down and separate the packed cells into distinct bands, okay? And then you're going to, results are printed out on a report form. On the requisition form, because there's too many tests on that CBC to be written on that requisition like we normally write the PT results or the glucose results or the hemoglobin results, we would say see report form, and then we would place that report form in our patient's chart, okay? And you will also notice under normal values, it will also see report form because there's too many normal reference ranges to, or the reference ranges to place on that requisition form as well. So those would be included on our report form so you could easily see what your result is and compare it against those reference ranges to see if your patient is within normal ranges or not. These are some other systems that's out there. Hematology instruments that can be used in physician's office labs or small outpatient labs. And then these are some things that had we been in lab, we would have done. But make sure, like I said, go out there and see if you can find something on the ESR and the QBC. And then make sure you watch the CoagaCheck video and do the discussion that's online, as well as the video and discussion for our Lab 14 section. And remember, this is telling us what we do at the end. And remember, in your discussion, I want you to conclude just bullet points, but cover everything that you should do that is important from beginning to the end when you're running a test on a patient. Okay, guys, hang in there. If you have any questions, comments, or concern, please email me. And if there's anything I can do for you guys, let me know. I'm going to be getting you out some information shortly. And you guys are on track. We're going to be doing well. Make sure you're watching your videos, filling out your study guides, and reading your textbook and getting ready for our next test. Have a great day.